In today's video, we are going to explore the uses of radiation in medicine, and specifically we will take a look at radiotherapy, which is used to treat cancer, and medical tracers, which can help us to detect problems inside the body. We saw in the last video that ionizing radiation can damage our cells by ionizing the atoms and molecules within them. Although this can cause general damage to the cells, the major issue is that it can mutate our deoxyribonucleic acid, which can occasionally lead to the formation of cancer. However, if our cells receive a sufficiently large dose, then they can be entirely destroyed. This is why if someone receives high levels of radiation throughout their entire body, they can suffer from what is called radiation sickness, which includes symptoms such as vomiting, fatigue, and hair loss. This is essentially because a significant number of cells have either been damaged severely or killed altogether, so overall the person feels extremely unwell. On the positive side, doctors can use this destructive power of radiation to specifically target and destroy cells that are undesirable, such as cancer cells. So while radiation has the potential to cause cancer, it also has the ability to treat it effectively. This entire process is known as radiotherapy, and it is primarily administered in two ways: externally or internally. External radiotherapy typically uses gamma rays that are directed at the cancerous area from several different directions so that the tumor receives the maximum dose while minimizing exposure to the surrounding healthy tissues. The internal form of radiotherapy involves placing a radioactive material inside the body, either within the tumor or adjacent to it. This method commonly employs beta radiation, which is more damaging than gamma radiation, but does not travel as far through the body, making it more targeted. Both methods, unfortunately, do come with side effects, as healthy cells in the surrounding area may also be affected or destroyed, leading to patients feeling ill during the course of their treatment. Another very important medical use of radiation involves the application of medical tracers. These are specific radioactive isotopes that are introduced into the body either by injection or ingestion and allow doctors to track their movement using the radiation they emit. By observing where these substances go and how they are absorbed by organs, doctors can determine whether those organs are functioning properly. For instance, if a person is given iodine 123, which emits gamma radiation, we can monitor whether the thyroid gland is absorbing it as expected. If the thyroid functions normally, we will detect gamma emissions confirming the iodine uptake. Gamma rays are preferred in these situations because they are less damaging to the body than alpha or beta radiation, although beta is occasionally used. Additionally, we aim to use isotopes that have very short half-lives so that they remain radioactive just long enough to conduct the necessary measurements and then decay quickly to avoid prolonged exposure. As we have seen in the cases of radiotherapy and medical tracers, radiation has great medical utility, but also significant risks. Therefore, every time we utilize radiation in a clinical context, we must carefully balance the potential benefits against the possible harm. For example, using medical tracers can be incredibly helpful in diagnosing illnesses, which makes the risk worth taking, especially when there is already reason to believe that the individual may have a disease. Still, we aim to minimize that risk by administering only a low dose and choosing isotopes that decay rapidly. When we consider cancer therapy, radiotherapy has the power to save lives, making it worth enduring the associated side effects. That said, some patients still decide not to undergo radiotherapy, particularly when the expected benefit is only a short extension of life rather than a cure. That concludes everything we wanted to cover in this video, and we hope you found it informative. If so, please consider giving us a like and subscribing for more content, and we will see you in the next video.